This is Dr. Murli Bharadwaj, your everyday classmate for the last minute NEETPG preparation. What is the most nagging, disgusting, worst topic in anesthesia we don't want to revise, but examiner love to ask in the tomorrow's exam? Mapleson anesthetic circuits. You have to be 100% sure, doctor. Let me make you the champions of this topic in 5 minutes. Mapleson circuits, they are typically semi-open, semi-closed systems. There is a fresh gas flow. Typically, it is high in Mapleson system and it is moderate in semi-closed system. Whereas in a closed circle, closed anesthetic circle, the fresh gas flow is low. So now, how many Mapleson circuits you know? Type A, Type A, Type B, Type D. Let us talk 1-2 comments about each of them. Type E and Type F. All right. So in all these things, just to remember one thing, there is something called fresh gas flow, FGF. There is a reservoir bag. There is a APL, which is an adjustable pressure relief valve. So where is this APL located? Is the bag is there or not? Where is the patient position? That is how all these things differ. So you have a reservoir, APL, patient, fresh gas flow. This is Mapleson A. But if you take the Mapleson E, what are you observing? No reservoir bag. That is the specialty of Mapleson E. Typically, the Mapleson E is used in case of pediatric patients. So pediatric kids don't need the bag. That's what you need to remember. Then where is the APL located? APL is typically located, that is first fresh gas flow, then bag, then APL, then patient, right? That is Mapleson A. But if you look at Mapleson D, there is a bag, there is an APL, there is a fresh gas flow immediately going to the patient. Similarly, the fresh gas flow and patient are close to each other, even in E and also in F. That's what you need to remember. Do you have an APL valve in Mapleson E? No APL in Mapleson E. No APL in Mapleson F also. In fact, Mapleson E has no APL, no reservoir bag. Whereas in Mapleson F, there is no APL, only reservoir bag. That's what you need to remember. Then generally, if you see the APL, where is it located? First fresh gas flow, then the APL. In the case of Mapleson A. Similarly, Mapleson B also first fresh gas flow, then APL. Fresh gas flow, APL. But if you look at the typical Mapleson D, APL is first and close to the reservoir bag, and fresh gas flow is close to the patient mask. These are few differences, just it's only a question of pictorial thinking. Now, fatafat, the final points for exam, yaad rakhna. Type A, what do you call other name for type A? Magel circuit. Type A is Magel circuit. It's also called lac circuit. Spontaneous ventilation ke liye Mapleson A is the best one. Fresh gas flow is required to prevent rebreathing, and that is equal to alveolar minute ventilation, which is 70 ml per kg per minute of the patient. That is a Mapleson A. And what else you remember? It can be used for both spontaneous and controlled ventilation. Basically, lac system is a modification of A where there is a coaxial circuit, that is tube inside the tube. So Mapleson A is also called lac when the tube is inside the tube is what you need to remember. Then type B, it is obsolete. No point in remembering it. Type D, typically it's called Bain's coaxial system, which is used in controlled ventilation. You can see the type D, which is basically called Bain's coaxial system, is what you need to remember. Now, the inspiratory limb is inside the expiratory limb. There is a fresh gas flow to prevent the rebreathing, but that is 1.6 times the minute volume in case of Mapleson D. Agree? Then टाइप ई जो होता है पीडियाट्रिक्स में इस्तेमाल करते हो, यहां अयंगार नहीं, अय्यर. इट्स नॉट अयंगार, अय्यर स्टीपीस. अय्या मीन्स डैडी. डैडी किसको होता है? बेबी को होता है. So that is the reason अय्यर स्टीपीस is for baby. Controlled ventilation neonates. And inlet is near the face mask. And typically, Mapleson E is used for weaning. You can remember, pediatrics mein hi hota na, weaning from the milk, breastfeeding, weaning. Weaning is a word used in pediatrics. No, you remember, type E is weaning. It does not have reservoir, bag and valve. Type F is also called Jackson-Rees modification. It does not have APL. And type F is also good for spontaneous ventilation in pediatric patient, because type F is modification of type E. Type E is used in pediatrics. Type F is also used in pediatrics. So modification of higher TPs or E used in children less than 6 years or less than 20 kgs is type F. Right? So don't forget type A, type D, type E, and type F. These are the 4 things that you need to remember. Then one final last word, which you need to remember. Fresh gas inlet is nearer the patient and DEF. Valveless circuits are E and F. Efficiency grading in spontaneous ventilation is A more than DF, E, C, B. B is least, A is most. Controlled ventilation, what do you use? D more than F, E, B, C, or E you don't use in controlled ventilation. It is only for spontaneous. So what is not used in controlled ventilation? Mapleson A system. Corrugated tube is not there in Mapleson Class C, but Class C is obsolete. Currently we are not using. And which Mapleson circuit has no reservoir back? Mapleson E or IRS TPs. Mapleson do not have APL, Mapleson E and Mapleson F. So don't forget to remember Dr. Murali Bharadwaj, your classmate, roommate, benchmate, tablemate, 24/7 available. Any doubt aaye to please ping me. You have my WhatsApp number. I am available to help you. Please be part of our 24/7 WhatsApp study group. I am leaving the link below. Be part of it and ask me what topics you want to release 5-minute, 6-minute videos.